Welcome to This Explainer. Today, we're really diving deep into a condition that's a profound part of our shared human experience. We'll be zooming way in on the fascinating genetic mechanics of Down syndrome before zooming right back out to look at the incredible medical and societal triumphs happening today. Let's get into it.
Normally, human cells have 23 pairs of chromosomes, right? Giving us a total of 46. But in Down syndrome, we see trisomy 21. The crucial thing here is that this extra page in the genetic instruction manual, bringing the total to 47 chromosomes, causes an overexpression of numerous genes. Think about it like a recipe. Imagine your recipe calls for 1 teaspoon of salt, but the instructions get printed twice, so you add 2. That extra genetic material fundamentally alters how the entire body is constructed, affecting everything from the nervous and cardiovascular systems all the way to the immune system.
Now, interestingly enough, Down syndrome isn't just one single genetic event. There are actually 3 distinct variations. While a huge majority, about 95% of cases, are classic trisomy 21 caused by chromosomes failing to separate properly, about 3 to 4% are translocation Down syndrome. This is where a piece of chromosome 21 actually snaps off and attaches to a completely different chromosome. And this one is unique because it can be inherited from a parent. Then, you've got the absolute rarest form, mosaicism, at just 1 to 2%. This is where only some cells in the body have the extra chromosome, which can actually lead to milder physical and cognitive manifestations.
So how common is this whole shebang? Globally, we're looking at a prevalence of about 1 in 700 live births. That makes it the most frequently occurring chromosomal abnormality in the world. It affects males and females equally across all racial, ethnic, and socioeconomic lines. Now, it is worth noting that the risk of that chromosomal error progressively rises for mothers over the age of 35. But since younger women account for the vast majority of pregnancies overall, statistically, many children with Down syndrome are actually born to younger mothers.
Physical and cognitive traits, the reality of the condition. We've seen the code, but how does it translate to a human being? This overexpression of genes leads to some very characteristic physical features that help doctors recognize the condition super early. You might already be familiar with a few, like the flattened facial profile or the single transverse palmar crease on the hands. There's also the sandal gap deformity, which is a distinct gap between the first and second toes. But the trait I really want to highlight here is generalized hypotonia, or low muscle tone. This isn't just cosmetic, guys. This low muscle tone directly impacts motor development, feeding, posture, and mobility during infancy. It's a real physical hurdle that requires targeted therapy right from day one.
Moving from physical to cognitive, intellectual disability is a defining feature, and it usually ranges from mild to moderate. Developmental milestones like sitting up, walking, or talking generally happen later than in typically developing kids. But here's where the data tells a deeply encouraging story. Despite these delays, individuals with Down syndrome very often demonstrate incredibly strong social engagement. They really want to connect with you. And early interventions like speech and occupational therapy drastically improve their ability to communicate effectively and engage fully with their communities. The potential for growth there is absolutely immense.
Because those genes on chromosome 21 influence multiple systems, we have to look holistically at the individual.
As we map this out, you can see Down syndrome impacts virtually every major organ system, which demands vigilant medical surveillance. Take the cardiac system. About half of all infants with Down syndrome are born with structural heart defects, like septal defects, which often means surgery early on. Respiratory issues like obstructive sleep apnea are super common, mostly thanks to that low muscle tone we talked about. In the GI system, things like duodenal atresia might require immediate surgical intervention right after birth. And on the endocrine side, hypothyroidism is highly prevalent. If we don't catch and treat that early, it can further impair cognitive development.
Now, here's a really vital connection regarding lifelong care. Because chromosome 21 is duplicated, every single gene on it is overexpressed. That includes the amyloid precursor protein, or APP gene. This means individuals with Down syndrome produce excessive amounts of amyloid protein throughout their entire lives. And this buildup leads to characteristic Alzheimer's disease pathology at a much younger age than the general population. In fact, neuropathological changes can actually kick off in early adulthood. As modern medicine helps these folks live longer, managing this age-related cognitive decline has become one of the most critical frontiers of care.
Screening and diagnosis, the medical journey. So how do doctors actually identify this complex blueprint early enough to prepare families?
Following this step-by-step prenatal journey shows exactly how medicine carefully narrows down the probabilities. It usually kicks off in the first trimester by combining an ultrasound of the baby's neck, the nuchal translucency, with maternal blood markers. If needed, the second trimester offers a quadruple test looking for specific patterns. More recently, non-invasive prenatal testing, or NIPT, has become a huge deal. It's a highly sensitive test that analyzes cell-free fetal DNA floating right around in the mother's bloodstream. But remember, all of these are just screenings. They only assess probability. To get a definitive diagnosis, you have to directly examine the fetal chromosomes through invasive procedures like amniocentesis.
What does life actually look like today?
Well, since there is no cure for the chromosomal abnormality itself, success completely relies on building a robust, multidisciplinary team around the individual. It literally takes a village. Pediatricians and cardiologists handle the internal systems, physical therapists tackle the hypotonia to help kids hit their motor milestones, and occupational and speech therapists work on daily independence and communication. Specialized nursing management is kind of the glue holding the whole operation together. When you combine that medical safety net with inclusive educational environments, you really optimize their health and maximize their independence.
The historical contrast here is absolutely staggering. If you look back at the 20th century, the prognosis was honestly pretty grim. Survival was often limited to early adulthood, and tragic, frequent institutionalization was just the norm. Now, look at today. Thanks to massive advances in things like cardiac surgery, infection control, and developmental support, the narrative has totally flipped. Life expectancy now routinely exceeds 60 years in developed healthcare systems. Individuals with Down syndrome are completing formal education, securing active jobs in their communities, and building deep, meaningful social relationships.
We've moved way beyond just surviving the blueprint. We're now talking about thriving. But this kind of progress asks something of all of us. As medical science successfully extends the lifespan of individuals with Down syndrome well past 60 years, how can our educational systems and our workplaces evolve to ensure they're fully included in every single aspect of society? I'm going to leave you with that thought to ponder, because the next great triumph in Down syndrome isn't just going to happen in a hospital or a lab. It's going to be entirely societal. Thanks so much for exploring this with me today.